Since the start of the pandemic, our routines have been in flux, including how we get our exercise and what we eat. With so many of us working from home right now, food is an all-day temptation. And now we're entering a season when we tend to indulge even more. Here to help us stay healthy and eat healthy during the holidays and beyond are Dr. Jaime Almandoz, an expert in non-surgical weight management, and Susan Rotter, a leader in our nutrition programs here at UT Southwestern. I appreciate you both being here. Dr. Almandoz, have you seen an interest in patients wanting to lose weight or manage their weight during the pandemic? And how does that compare to what you would normally see before all this started?
Oh yeah, we're a popular program to begin with, but we've certainly seen a surge in interest in the weight wellness program since the onset of the pandemic, and we're certainly welcoming a lot of patients back. We recently published a paper with data from our patients showing that people are certainly stress eating more, stockpiling food, and exercising less. But what's really quite shocking is that more than 80% of people are reporting worsening depression, 73% are reporting increasing anxiety, and almost 10% have lost their job. And I think it's really hard to focus on your weight when you have so much going on.
Susan, what are you hearing from your patients? Are they more interested in weight management and nutrition since all this started or less?
They know that this is a time where it would be likely for them to gain weight, and that does make them a bit nervous. The kitchen is very accessible. They have lost their jobs. They have more limited income. They're worried about going to the grocery store. They're worried about someone else picking out their fresh fruits and vegetables if they're ordering online. So they're making an attempt to manage their weight, but it is another challenge during this period of time.
Dr. Almandoz, we hear two different terms often when people are talking about healthy weights, weight loss and weight management. What's the difference?
I think weight management is really more of what we do because it encompasses not just treating excess body weight, but approaching this in a patient-centered and evidence-based way to provide people with tools to achieve a healthier body weight and to maintain it. I think too often in healthcare, we try to look at weight management as an accounting function where we just tell people to eat less, move more, and if that doesn't work, try harder. What we need to do is acknowledge that obesity and excess body weight is a very complicated disease that incorporates genetics, environment, everything from that to food policy and the stress of a pandemic. And what we need to do is meet each person where they're at and find an individualized plan to help them get to a healthier body weight.
Susan, you mentioned just a moment ago that food is more accessible, the kitchen is closer. With so many people working from home right now, what advice do you give them to manage that? They're obviously they're under stress, they're doing things differently than what they've done before, and food's right near them most of the time.
They have to kind of go back to trying to follow somewhat of a schedule rather than returning to the kitchen for yet another snack. So that can be a real big challenge for them, and they need to kind of go back to the basics of having 2 to 3 meals per day and limiting calorie containing beverages and just keeping into more of a routine.
Dr. Almandoz, as we begin the holiday season, it's always harder to do the right things most of the time during the holiday season. Everybody talks about everything in moderation. What advice do you give people as they head into the holiday season, and especially this holiday season in the middle of a pandemic?
I think too many people have this love-hate relationship with food, which is so central to all of our celebrations. And in weight wellness, we really believe that there's no such thing as a bad food, just one we're enjoying too much or too frequently. And I think that denying ourselves completely can make consistent healthy behavior so much more challenging. So I believe that moderation really is key to kind of a healthier relationship with food and your weight.
Susan, what advice do you give your patients as they enter the holiday season, especially this holiday season?
Balancing those traditional foods that you really enjoy and might only be available once a year and eating them mindfully in modest portions, but not denying yourself those treats. Maybe foregoing things that are available all the time, like bread or potato chips or something that's not so unique or special. And then it's really important for our patients not to, for example, eat all weekend following Thanksgiving.
Dr. Almandoz, many of us are finding it harder to exercise as we begin to enter the winter months. Give us some advice on people who are thinking about healthy ways to go to the gym and to do indoor exercise as opposed to the outdoor exercise they might have been doing throughout the spring and summer.
Yeah, physical activity is so great for our bodies and our minds. And during the pandemic, it can be a really great tool for stress management. As you said, going to the gym is really not one of the safest things to do right now. And there are lots of ways in which we can increase our activity levels to get the benefits of exercise without exposing ourselves to the risk. There are a ton of free apps and online videos that can help people to start physical activity programs at home using their body weight or things that they may have around the house. Or you can just start a simple walking program with friends in a socially distanced way. But physical activity could be doing some more mundane stuff around the house, like some yard work or tackling the attic or the garage or things that you've been putting off.
Susan, are there supplements that you can take that prevent COVID-19 or its effects?
There are not supplements that can prevent COVID or that are used per se to treat COVID. We do know that individuals who have low vitamin D levels and low zinc levels do seem to benefit if those deficiencies are made up for. A regular multivitamin, which will include the RDA for vitamin D and zinc, and in addition include vitamin C, would be helpful. Other supplements that patients are taking are elderberry, echinacea, coconut oil, lysine, apple cider vinegar. There's no evidence at all that any of these dietary supplements, prevent or treat COVID.
Dr. Almandoz, the stress level of everyone is up during the pandemic, and many people are drinking more alcohol and eating differently than what they were doing before, obviously contributing to even more anxiety and, as you said, depression. What advice do you give them about how to change that balance in their habits?
I think this is really a two-way street, that we really struggle with healthy eating and moderating our drinking when we're stressed, anxious, or feeling low. And self-care and creating these sustainable, healthy habits is so important to striking a balance for our overall health. And I think what we need to do is plan to enjoy the holiday season. I think we all need a little bit of break. But also, if we realize that our health behaviors are becoming problematic, to reach out to your healthcare team, because we're really here to help.
Susan, alcohol is a big part of celebrating for many people, and we've seen throughout the pandemic that in general, people are drinking more. What's your advice on the right amount of alcohol for people to have routinely and during the holidays?
We know generally that the recommendations are 2 alcoholic beverages per day for men and 1 for women. During the holidays, people are going to drink more than that typically. I encourage patients to use a spacer, which is like a sparkling water, just a glass of water in between glasses of wine, something along those lines. But trying to keep that in check, because as they plan to be mindful about eating their favorite traditional foods, if they get a bit too much alcohol, they let down their guard and then they kind of feel badly later that day or the next day.
Dr. Almandoz, as we begin to say goodbye to 2020, what are your final thoughts on ways that we should be thinking about weight management and healthy eating as we go through the holiday season?
I think the challenge is that 2020 may be over, but the pandemic isn't. And I think many of us need to switch from survival mode to creating more kind of healthy, sustainable habits to last us through the pandemic and beyond. And, that can include reconnecting with healthcare providers to schedule any missed visits or health screenings. But, in terms of practical advice, I think we need to focus on staying connected or reconnecting with loved ones in new and different ways. Work on finding a variety of things to eat and do rather than being rigid or exclusionary in what we're choosing. And more importantly, I think we need to be kind to each other and to ourselves. There's no guidebook for surviving a pandemic, and I think we're all doing the best that we can.
Thank you both for joining us and for all this good information as we think about the most complicated holiday season of our lives.
Thank you, Dr. Warner.
Great. Thank you very much.
Until next week, stay safe and stay healthy.